to talk a lot about the etiologies and the differential diagnosis. We're going to see what we should do when we have a patient with diarrhea and the therapies that we should provide. Okay? So assume that you have a patient, a 4-year-old boy, who comes with his mother to your clinic. Let me just maximize the size of the slides. Okay. Guys, please ask if you have any questions, and you can turn on your microphones whenever you want, okay? You can also write in the chat. So we have a 4-year-old boy who comes to your clinic with his mother. The mother says that the boy has diarrhea. We want to see what you should ask about this patient and what parts should you examine. Can anybody help me with this? We can either turn on your microphones or you can write in the chat forum. A patient with diarrhea, a 4-year-old with diarrhea comes to the clinic with diarrhea. The mother says that he has diarrhea. What should you ask? What are the important things that you should focus on, we should know about?
Salam, Professor.
Salam. I hope you're doing well.
Yes, I think the first thing is to determine the level of dehydration. So maybe you want to know when the diarrhea started and how severe has it been. So maybe you want to know the frequency, the amount of the vomiters or the diarrhea. You want to know if there is any fever also to get a little bit of the etiology.
Mm-hmm. Great. Yeah, right. So a very important question, as you said, is asking about fever, because there are lots of etiologies for diarrhea, and we want to know, first of all, if the diarrhea has an infectious source, or maybe it's not infectious. Maybe it's because of other pathologies. For example, we have colitis, we have inflammatory bowel disease, we have diarrhea accompanying, for example, rheumatologic diseases, intoxications, many differential diagnoses. Okay, so when the patient mentions that he has a fever, or the mother mentions that the patient has had a fever, your differential diagnosis will be narrowed down, and there are some other important things that you should do. For example, you should think if you need to prescribe antibiotics for the patient, and some other things. We're not going to talk Sorry, I just, I had a problem with the connection, I suppose. I will share the screen again. Okay, so the other thing that Ranga said, guys, I'm sorry, but I think I need to just keep the size of the slides in this size, because I will have problems with my connection otherwise. So can you say what other things are important? Ranga also said we should know about dehydration. Dehydration is important. There are certain signs for dehydration that I will show you here. They are very much important. Somebody has written something in the chat. Okay, Dr. Zay has asked me to stop my video because my internet connection is weak. So sorry, I'm stopping my video. Okay. So we have a table here. This table is from your Nelson Essential book, okay? We're going to talk about the details later in this session, but look here for signs and symptoms, okay? It's very important to evaluate your patient for tachycardia. If there is no tachycardia, then the patient can have mild dehydration, okay? Let's talk about mild and moderate and severe dehydration later. Just look here at the first column. Tachycardia, palpable pulses. It means that if a patient if a patient's pulses cannot be palpated, if you cannot find the pulses of the patient, then the patient is dehydrated. He might be even in the first stages of shock. So it's very important to search for the pulses of the patient. It's very important to listen to the heart and to count the heart rate, okay, by palpating the pulse. It's important to take the blood pressure, to search for the cutaneous perfusion. The cutaneous perfusion, it means that the perfusion and the adequacy of circulation, okay? When the patient is dehydrated, then you will not have adequate circulation. Let's take a look here. As you can see, the doctor is pressing the nail bed of the patient and then he lets go, okay? When you press the nail bed, you will see that the nail becomes pale, the nail becomes white. And then when you let go, immediately the blood will be restored and the nail bed will be pink. Okay, so this means that the capillary refill is okay. We call this test capillary refill test. Okay, it means that the perfusion is okay. The normal capillary refill should be about 2 seconds. If it's longer than that, then it means that there's a problem with perfusion. And then take a look here at the skin turgor. As you can see, he's pinching the skin, okay, and then he lets go. If after the pinching, this mark is still there, there is this fold in the skin, it means that the skin turgor is decreased. Okay, you can do this with the skin of the abdomen of the child, because usually their hands and their feet are not fatty and you cannot do this easily. Okay, if there is this mark, if the skin is not immediately back to its normal condition, then the skin turgor is decreased, and then you can understand that there is the problem of dehydration with the patient. Okay, so we go back to the table. You should also check for the depression of the fontanelle. This is measurable in patients usually less than 1 year old, because in patients older than 1 year old, the fontanelle is closed and you cannot observe any depression or elevation of fontanelle. So if the fontanelle is depressed, it means that the patient is dehydrated. You should also check the mucous membranes. It means that you should look at the lips, maybe look at the inside of the mouth of the patient. If it's very dry, it means that the patient is dehydrated. Other things that you should ask, one of the other things that you should ask is if the patient has tears when he cries. We always ask this from the mother. We say, does he have tears when he cries? If the patient is dehydrated, then there will be no tear. Okay, and you should also check for the respiration. If the respiration is deep or if it's rapid, it means that the patient is dehydrated. And urine output, this is very important and a very important question. You should ask the mother if the urine output has decreased. So if the urine output has decreased, if the amount of urine has decreased, it means that the patient is dehydrated. Yeah, Mubashir Ahmad says urine output, thirst. Yeah, right. Thirst is also very important. You ask the mother if the patient is little, if he cannot explain himself. You ask the mother if the patient is very thirsty, if he's always asking for more milk, if he's asking for more fluids, more water. So this is very important. It means that the patient is thirsty, he's dehydrated. So these are the things that you should check for and you should ask for. Okay. So now we know that we have a patient who has diarrhea. Okay, I'm not going to talk about the etiologies today. It doesn't differ whether your patient is having diarrhea because of an infectious process or a rheumatologic process or a toxic process or anything else. In all of these conditions, the patient is losing fluid and is losing electrolytes. And your most important job is to restore those fluid and electrolytes that I talked about. Okay, so today we're going to focus on how to replace that fluid and electrolyte. Later on, we will talk about the etiology, focusing on the infectious etiology, okay, and what to do with this etiology that is very common with children, okay? So today we're going to talk about the fluid and electrolyte replacement. The total amount of fluid and of the nutrients and of the food that anyone takes within each day is depicted here, okay? It's called, first of all, maintenance. For example, for me, in a normal day, all the things that I take, all the things that I eat and drink, it is calculated in the maintenance fluid that I need, okay? It does not differ if you're talking about a child or if you're talking about an adult. These principles are the same for the child and for an adult. And you should know that the fluid that we lose every day in the form of urine, in the form of sweat, and when we defecate, it's calculated within the maintenance, okay? And if anyone has some more loss than that, then he will have deficits. For example, if a patient has diarrhea, he's losing more stool than normal, okay? So it should be calculated and it should be understood that this patient has already lost some fluid, so he has some deficit. There is a loss in the total body water that the patient should have, okay? I'm sorry for the noise that you might be hearing here. And also, if a patient is sweating a lot, for example, if you're very thirsty today, you have sweat a lot today, you have been working a lot today, maybe working out, so you have lost a certain amount of water. So this should be calculated. Today, you will need to drink more because you have deficits. Okay, and ongoing loss. Ongoing loss means the amount of fluid that is on an ongoing basis is being lost. Okay, it means that each time that the patient has diarrhea, you should restore, you should compensate for that amount of diarrhea, that amount of stool that the patient is losing. Okay, we're going to talk in detail about each of these parts. First of all, maintenance. Okay, I told you this rule is the same for a child or for an adult, and also it is not different for a patient who has diarrhea, a patient who has vomiting, or a normal patient. Assume, for example, that you have a normal patient, a very normal patient that comes to your office because he has had a leg fracture and he's going to have a surgery tomorrow morning, okay? And the surgeon calls and asks you to make the patient MPO for the next day. MPO means, do you know what MPO means? Can anybody tell me what MPO means? I just want to know if you're still with me. So nobody can tell me what an MPO means? I'm becoming a little dissuaded here. Nothing per oral, fasting, right? Thank you, Ranga. Okay, so you're making the patient MPO because he is going to have a surgery, he's going to be unconscious, and he should not drink or eat for a couple of hours because otherwise he will go through aspiration when he is becoming unconscious. Okay, there is another answer, nothing by mouse. Yeah, right, Irene and Fahime. Thank you very much. Okay, so you should calculate how much fluid you should give the patient from now until tomorrow after the surgery when the patient becomes conscious again. Okay. Also, this is the same case if a patient has diarrhea and he comes to your office and you understand that he is very much dehydrated. We're going to talk about the amount, severity of dehydration later on. And so you see that the patient is vomiting. He cannot take anything by mouth. So you make the patient MPO and you will calculate the maintenance fluid that the patient needs. Okay. The first part, maintenance. Okay, how should we calculate the maintenance? For the first 10 kilograms, we calculate 100 cc or milliliters per kilogram. It means that if the patient is, if the patient's weight is 6 kilograms, then you should calculate 600 milliliters of fluid. You should give him 600 milliliters of fluid within 1 day, within 24 hours. Okay, is that clear? Okay. For the second 10 kilograms, it means that if the patient's weight is more than 10 kilograms, between 10 and 20, okay, you will calculate 50 cc or 50 milliliters per kilogram. For example, we have a patient whose weight is 15 kilograms. For the first 10 kilograms, you will calculate 100 cc, 100 milliliters per kilogram. It means that you multiply 100 by 10. The first 10 kilograms multiplied by 100. And then you add this to the second 10 kilograms. How many do we have in the second 10 kilograms? We have 5, okay? So you will multiply 5 by 50 milliliters per kilogram for the second 10 kilograms. So we will have 1,000 here, then 250 here as a result of multiplying 5 by 550. So we will have 1,250 milliliters as a result. Okay. You're going to practice it in the next slide, so just pay attention here. For the third 10 kilogram and more, you will calculate 20 cc's or milliliters per kilogram. For example, you have a patient whose weight is 32 kilograms. The first 10 kilograms, you multiply it by 100. The second 10 kilograms, you multiply it by 50. And then after the first 20 kilograms, you have 12 kilograms excess, okay? So you multiply 12 by 20 cc's per kilogram. You have 1,000 here, then you have 500 here, and then you have 240 here. By adding the 3, you will have 1,740 milliliters for 24 hours. This is the amount of fluid that the patient needs, that the patient with the weight of 32 needs for 1 day. If he's able to drink, he's going to drink this amount of fluid himself. If he's not able to drink or take by mouth, then you should give this water, give this fluid. Of course, it's not only water, it includes some electrolytes by IV therapy. Okay. So now I'm asking you to calculate this. A 7-year-old girl who is 22 kilograms is going to have a foot surgery tomorrow and you make her NPO. How much fluid for 1 day do you prescribe? Can you please calculate this for me? A 7-year-old girl, 22 kilograms. I'm waiting, guys. Malik says 1,600. Are others okay with this? Approximately 1,600. $1,540. Thank you, Muhammad, Ranga, Who is this? ZG, I don't know your name, and Mubashir. I would like to get to know you. Our friend whose abbreviation of name is ZG. Can you introduce yourself? And Malik Rahman, Malik says 1,600. Okay, let's calculate it together. Okay, Mohammed, just pay attention. This is 1,540 milliliters. There is no per kilogram because you have already calculated the kilograms in this formula that I gave you, okay? This is per kilogram. 100 cc per kilogram for the first 10, 50 per kilogram for the second, and then 20 per kilogram. Because you have already calculated the kilograms in this formula, then you have a total amount of 1,540. As you have all correctly calculated, the first 10 kilograms gives us 1,000. The second 10 kilograms gives us 500. So up to now, we have 1,500, and then we have a 2 multiplied by 20. So we will have 40. Okay, 1,540. Great, guy. Thank you very much. Okay, so we reach again this table of ours. We have already talked about the signs and symptoms, but the severity and the degree of these signs and symptoms is also important. Why is that? Why is that important? Because we need to know how much fluid has the patient lost and how much should we calculate now for the deficit of the patient, okay? We will categorize the degree and the severity of dehydration into these three categories: mild, moderate, and severe, okay? For an infant, as you can see here, it means for a patient under 1 year old, okay? We have 5% of dehydration if we categorize him in the mild dehydration category, okay? If we categorize him under moderate category, then he has 10% of loss. If we categorize him under severe category, then he has 15% of loss. The same for the patients more than 1 year old gives us 3%, 6%, and 9%. It means that if I say that a patient, for example, a patient who is 4 years old, he has 4 years old, if he has mild dehydration, then it means that approximately 3% of his body fluids are lost. And we should calculate it, and we should add it to the water and to the fluid that we are going to prescribe for the child. Okay, so this is how we calculate this amount of fluid. The deficit fluid that we should give the patient in a day, in 24 hours, it is calculated like this. You multiply the weight of the patient by 10. This is the constant number. It's always 10. Okay, by the deficit percent. You have the deficit percent here. You should memorize this. This is in your book, okay? And you should know about it. For the interns, it's absolutely important because they're going to prescribe the water soon for the patients, the fluid soon for the patients, but you also should know it. You will be asked about this. So you multiply the weight by 10 by the deficit percent. For example, if you estimate that the patient's dehydration is under the moderate category and the patient is, for example, 6 months old, okay? So he has a 10% loss. He has a deficit of 10%. Then you will multiply his weight by 10 by 10, okay? Let's look at the example here. We have a 4-year-old boy, 16 kilograms with mild dehydration. You're welcome, Mohammed. Okay, we have a 4-year-old boy, 16 kilograms with mild dehydration, okay? So he is 4 years old, so he is here in the second column. more than 1 year old. Now we will look here. He says mild dehydration. It says mild dehydration. So we will find it here. Mild dehydration, more than 1 year old. He has 3% loss. Okay. So what should we do? We should multiply his weight by 10 by 3, which is the deficit percent of this patient. Okay. How much is his weight? He has 16 kilogram of weight. Okay. So you multiply 16 by 10 by 3, and then you will have 480. This is the amount of deficit. This is the amount that the patient is lacking, that the patient has already lost, and you should give him this fluid. You should compensate this fluid, okay? You should also give the patient the maintenance. Never should you forget about the maintenance, okay? The maintenance that the patient should be given is how much? Because he has 16 kilograms of weight, you will have for the first 10 kilograms 100 cc's per kilogram. For the next 6 kilograms, because it's within the second 10 kilograms, 6 multiplied by 50, then you will have 1000 plus 300, you will have 1300. Okay, the total amount of the fluid that you should give this patient is calculated by adding these two numbers. You will have 1,300 for the maintenance, and you will have 480 for the deficit. So you will have 1,780 cc or milliliters of fluid that you should give this patient within 1 day. Okay, I hope it's clear. We're going to work on it soon. Just let me clarify it a little bit for you here. You might ask now, how should we know that a patient's dehydration is in the category of mild, moderate, or severe? This is how you calculate that. This is how you, in fact, interpret that, okay? You should have an assumption by looking at these signs and symptoms. It's not important that you memorize them all. I will explain it and it will be really clear to you, okay? A patient has mild dehydration if he's only thirsty. All the other signs and symptoms should be normal. The patient should not be tachycardic. He should have palpable pulses. He should have normal blood pressure. He should have normal perfusion and normal capillary refill, normal skin turgor, normal fontanelles, normal membranes. Moist means it has water, it's normal. Tears should be present, respiration should be normal, and the urine output should be normal, okay? So the patient has mild dehydration if he's only thirsty, okay? If there is anything else, he's at least moderately dehydrated. Maybe he's severely dehydrated, but he's not mildly dehydrated, okay? If there is any sign or symptom besides being thirsty, okay? And as we have already learned, for an infant who has less than 1 year old, we should have 5% deficit calculated, okay? If he is older than 1 year old, then 3%, okay? Any patient who has loss of consciousness will be categorized in the severe category. Remember that, okay? But other than that, we have some patients who have not lost their consciousness, but they are categorized as severely dehydrated. You should check for these signs. If the patient is a little tachycardic, he's moderately dehydrated. If he is very much tachycardic, then he's severely dehydrated, okay? All of these are like this. If the pulses are weak, then moderately dehydrated. If the pulses are decreased or they cannot be found easily, then the is severely dehydrated. If the blood pressure is decreased, then the patient is severely dehydrated. But if there is only orthostatic hypotension, the patient is moderately dehydrated, okay? So you should look at these signs and you should estimate the degree of dehydration. A very important sign is urine output. If the patient does not have any urine, if he has been anuric for the last 6 hours, that's the definition of anuria for us, or if he's severely oliguric, it means that he has a very low amount of urine output, then the patient is severely dehydrated, and you should pay attention to this patient instantly, very quickly. So this is how you estimate the category, and then when you estimate the category, you will calculate the amount of deficits, okay, and the amount of the fluid that the patient needs. Okay, so for the same patient, the 22-kilogram girl, you have already calculated 1,540 for maintenance. Now assume that this patient has moderate dehydration. Can you tell me the deficit of a patient with moderate dehydration and with a weight of 22 kilograms? Moderate dehydration. Mubashir says 1,320, also Malik, and also Ranga. Any other ideas? Also Irene. I like the name Irene. I would like to know if it's read like Irene, because I have also heard Irene in some other languages. Can you tell me? It's a beautiful name. It's the same. So I can both call you Irene or Irene. Like, I like Irene more, I think. Both of them are very beautiful. You have a beautiful name. Okay, that's correct. I'm so happy that you have learned it well. So what we did was to multiply 22 by 6, which is the amount of deficit, the percent of deficit, if you have a patient who is moderately dehydrated, and he has the age of more than 1 year old. You will categorize it here. So you will multiply the weight, that is 22, by 6 by 10. And then, as you have all said, you will have 1,320. And so if you want to calculate the total amount of fluid that you should give to this patient in 1 day, okay, you should, yeah, that's correct. You should add 1,540 to 1,320. Then you will have 2,860. So just guys, pay attention that we normally in the clinic do not prescribe all of this fluid at once. You know, I mean that I do not usually write this amount of fluid for the nurse to calculate, to give to the patient in 24 hours. I divide it for a duration of 6 hours or 8 hours, okay? Because if I am estimating that the dehydration of this child is now under the category of moderate, I expect that after 3 or 4 hours, after 5 or 6 hours, the dehydration will become less. I expect that after giving some fluid to the patient will become less dehydrated in a couple of hours. So I will not give this amount of water, this amount of fluid for the next 24 hours. I calculate it this way, but then I divide it by 3 if I want to give it in 8 hours, or I divide it by 4 if I want to give it in 6 hours, okay? And then after 6 hours or after 8 hours, I reconsider, I recalculate, I visit the patient, okay? And then I will calculate again. If I see the patient again, and if I understand that now the patient is not moderately dehydrated, he's mildly dehydrated, I will calculate again with the deficit for a mildly dehydrated patient, okay? It's good to know for you because this is how we do in the clinic. This is how we do in our ward. And if you see that we do this for our patients, you will understand it better. Okay. So we are nearly done. I just want to tell you one little point here. This is again a table from your own book. When you want to restore the intravascular volume of the patient, if the patient is moderately dehydrated or if the patient is severely dehydrated, you should first give a bolus of fluid to the patient. It means that you will give a good deal of that fluid that you have calculated in a short time, okay? Because when you see the patient, as I said, you will find signs of bad circulation, of bad perfusion. I want the perfusion to be back to normal rather soon. No, I don't want to wait for it for 6 hours, for 8 hours to get back to normal, because I need my child to be perfused well in a short time, okay? And then I will give the amount of water that I calculated on a timely basis, okay? Let me see what this is. Normal saline. No, this is not normal saline. This is not because Dr. Ziai has insisted that we do not make the sessions very long, and I think some of you guys who have not been familiar with the concept will be a little perplexed. I will talk about the type of the fluid that you will give to the patient in the next session. Just I wanted to be sure in this session that you have understood the concept of the fluid therapy, and then we will talk about the content later, okay? This is not normal saline, okay? Because the fluid that you give to a child should contain dextrose always, okay? Just not in the case of the stat that I'm talking about right now, okay? I will explain in detail in the next session about the content of fluids. Just pay attention here. I just wanted to tell you that you're going to give a certain amount of fluid in 24 hours or in 8 hours or in 6 hours. But first, in the first 20 minutes, you will give a bolus of water, a bolus of fluid, because you want the patient to be perfused a little. And then little by little, you will give the serum that you have calculated to the patient. And this stats or this bolus of fluid that you give to the patient is calculated in this way: 20 cc per kilogram over 20 minutes. For example, for the same child that we had, he's 22 kilograms, okay? You will multiply 20 by 22, and then you will have 440, okay? You will give this amount of water, this amount of fluid in 20 minutes, and then you will subtract this fluid that you have already given to the patient from the fluid that you have calculated before, okay? Look here. This is a 4-year-old boy, 16 kilograms, moderate dehydration, who has not urinated since 6 hours ago. This is a very bad sign. If the patient has not urinated for the last 6 hours, okay, in fact, he might be even severely dehydrated. Let's assume that he is moderately dehydrated because we want to calculate it like this. But this shows me that I need to reperfuse the patient quickly because he has not urinated. His potassium may be very high now. His creatinine may be very high now. His kidneys are in danger because he has not urinated, okay? So yeah, I will make full screen, sorry. But I think my Zoom will go if I make full screen. Yeah, I'm really sorry, but I don't know why, but I have a good connection and I have paid well for it. But when I change the slides into full screen form, my Zoom quits. So I'm really sorry. Okay. Look, so when you have a patient with 16 kilograms and he has not urinated, it means that the condition is very dire. It's very dangerous. You should reperfuse very quickly. Okay. So what you have to do is to reperfuse him with the stats, with the bolus of water. The stats, here I have in orange, is calculated by multiplying 20 by 16. You will have 320, okay? How much is the maintenance? The maintenance for a patient with 16 kilograms of weight is 10 multiplied by 100 plus 6 multiplied by 50. Okay, so you will have 1,300 for maintenance. For deficit fluid, he is 16 kilograms. He has 16 kilograms of weight. You multiply it by the constant number of 10, and then you multiply it by the deficit percent. He has moderate dehydration. He is more than 1 year old, so the deficit percent is 6. The result of this is 960. Now you will add the maintenance to the deficit, and then you subtract this stat because you have already reperfused the patient in 20 minutes with 320 milliliters of fluid. The content of the fluid will be discussed later, okay? So you subtract this. So first of all, in 20 minutes, you will give 320 milliliters of fluid to the patient. Then for the next 24 hours, you will give the patient 1,940 cc's of fluid. You can then divide this amount of water, this amount of fluid by 3 if you want to give the patient the fluid in 8 hours. If you want to give the fluid in 6 hours, you will divide it by 4. Okay? So are we clear about the concept of the stats? Because I'm going to leave you with the information that I gave you. And in the next session, we're going to talk about the ongoing loss that we have here, the ORS, and I want you to be completely comfortable with the contents that I have already taught you today. Are you okay? Can you calculate the amount of deficit and maintenance? Because I'm going to ask you in the beginning of the next class. Does anybody have any questions? Ranga says yes. Anybody else? If you have questions, do not hesitate to ask because I'm here to answer you. So the approach to diarrhea is dehydration. The most important thing that you should consider when you're treating a patient with diarrhea is dehydration. And then, yeah, you should, first of all, you should restore the dehydration. You should compensate for the dehydration. Then you will think about the etiology. It's not very much important. If the patient is dehydrated, just rescue him, you know. After you have started to rescue him, you're sure that the patient is safe now. You have time to think about the etiology, okay? Can you please repeat the first calculations again? The first calculations are for MPO, of course, yeah. Okay, look here. For the first 10 kilograms of the patient, of the weight of the patient, we will multiply 100 cc's for each kilogram. For example, if the patient is 6 kilograms, we will multiply 100 by 6. For the second 10 kilograms, we multiply 50. For example, if the patient is 15 kilograms, has 15 kilograms of weight, we multiply 10 by 100. Then we add the next 5, which is within the second 10 kilograms, by 50. Okay, so you have 1,000 plus 250. You have 1,250. For the third 10 kilogram and more, you will multiply 20 cc per kilograms. For example, when the patient has 32 kilograms, you will multiply 10 by 100. Then you will add it to 10 by 50. Then you will add it to 12 multiplied by 20. You will have 1,740. Irene, is that okay with you? Mubashir says, is this the approach for a patient with gastroenteritis? Yes, yes. Well, today we're talking about the patient with gastroenteritis. When you have a patient with gastroenteritis, he is dehydrated. He has lost some water, so he has deficits, you know? So you will calculate the maintenance and the deficit. If the patient is not dehydrated, then you will calculate only the maintenance, because the dehydration percent or the deficit percent is 0%. So you will have 0 deficits, okay? You will only have maintenance. As I told you, in all the patients, the fluid that you calculate is like this: maintenance, deficit, and ongoing loss, okay? In any patient, a patient who is going to have a surgery. A patient who is going to have a surgery does not have ongoing loss, does not have deficit, so only maintenance. A patient who is having diarrhea, he needs the maintenance, like all the patients. He also has deficit, and he also has ongoing loss. About ongoing loss, I'm going to talk about in the next session, but we should know that ongoing loss is not calculated in the IV therapy that you're giving the patient first. You know, it's calculated for each time that the patient is losing something. For example, if the patient is polyuric, okay, each time that the patient is losing more urine than normal, you should add something, okay? But because, for example, right now that I'm visiting a patient who has diarrhea, okay, I'm seeing that the patient has diarrhea, I'm seeing that the patient is dehydrated and is moderately dehydrated, so he has 6% of dehydration. But I don't know if the patient is going to defecate today for 3 times or for 6 times or for 10 times, okay? So I will decide this later. Whenever the patient defecates, I will add a certain amount to his diets, you know, or to his IV therapy. I will explain about it later, but it's not calculated in this way. The water that you're going to calculate for the 24 hours of the patient is calculated in the way that I told you, by the maintenance calculation and deficit calculation. Mubashir says, okay, thank you. I recommend, because it's going to be boring if I explain for more than 1 hour, and we are nearly, I have nearly talked about 1 hour today. I recommend that you join me in the next session. I will have the class next week, this time, and I will explain about the rest of it. And then when I summarize all the aspects, I think you will have a better understanding of how to manage gastroenteritis fully. Okay, is there any other question? You're welcome, you're very welcome. You're very welcome. If you're okay, and if you don't have questions, I think we can wait for the next session. And please practice a little bit and think about it. If you have any other questions, I will be gladly answering you in the next session. You're welcome, Ivana. You're very welcome, guys. Thank you for joining the class today. Khaste nabashid and goodbye. You're welcome, Muhammad and Niasha. And Banafshe Malik. Goodbye. Goodbye, guys. You're welcome.